If a woman of menstruating age comes to you with headache, 9 out of 10 times it will be related to her menstruation. So, how does one differentiate this headache from others? So, here we have three different patterns: liver blood stagnation, hyperactive yang in the liver and kidney, and liver blood deficiency. So, for headache secondary to liver blood stagnation, mostly the pain would be on the vertex or unilateral. The side may vary. Headache is premenstrual and it improves with periods. So before menstruation, the headache sets in. Other symptoms are premenstrual tension, water retention, breast distension, irritability, constipation, nausea, coldness, and lower abdominal heaviness and discomfort. The character of the headache can feel heavy, pressure from outside to inside. So it's like wearing a helmet. Worse in the nights and on waking, better in the day, improves in fresh air and with black coffee. So tongue, purple on the sides, with teeth marks, slimy or slippery white coating. Now let's go to headache, secondary to hyperactive yang in the liver and kidney. So this is mostly one-sided at a time or at the point where the bladder 2 acupuncture point is located. So headache can be with maximum bleeding or during ovulation time. Other symptoms, generally short cycles, feels hot before and during period, vomiting with headache, photophobia and phonophobia, prone to yang type backache and occipital pain, abdominal colic, and diarrhea during menstruation. Headache feels sharp, pulsating, pressure as if the head would explode. Better at night and while asleep, better if they can eat, worse with stress and activity. Tongue, red on the sides with cracks or red papillae. Now let's talk about headache, secondary to liver blood deficiency in women. Fairly generalized in the head, the entire scalp is sore. The most pain points could be on the side or vertex. Other symptoms associated with it are dizziness, blurred vision, tinnitus, poor sleep and concentration, weakness of the limbs, pale and drained. Headache will start at the end of menstrual bleeding. So now we can categorize the headaches into three. So with liver blood stagnation, the headache will come before the menstruation. We'll have hyperactive yang in the liver or kidney during menstruation. And all the liver blood deficiency, the headache will be at the end of the menstrual bleeding. And this will last for 4 to 5 or more days. It is dull because it's blood deficiency with a very hypersensitive scalp. There is feeling of emptiness in the head, so that it's very blood deficiency. Sore, sunken eyes, pale gray face. The tongue is pale on the sides, thin and dry coating. And for treatment, for the headache, secondary to liver blood stagnation, we use bladder 18, GB37, stomach 40, Li4, local points, plus local points. Treat 3 to 4 sessions in mid-cycle for 3 months. For headache, secondary to hyperactive yang in the liver and kidney, we use REN3, kidney 4, bladder 40, spleen 6, local points. Treat once weekly for 3 months. If the headache is secondary to liver blood deficiency, we use REN13, bladder 15, bladder 17, GB39, plus local points. And we supplement with iron and proteins, treat once weekly for 3 months.